in Apprentice, the Presidential Apprentice season 1, part of his intent was to privatize military hospitals, and I still believe they're moving in that direction.
I certainly hope not, but I can tell you that so my university has the largest population of military affiliated students in the UNC system. And so we have a ton of students for whom accessing healthcare is absolutely horrifying. And they will come to class and say, listen, I can't take the exam because I have an appointment with the VA. We're like, just go, because we know if they miss it or if they're a few minutes late to it, that's another 6-month delay in being able to get in to see a doctor. And I'm talking about folks who have needed surgeries, folks who have needed prescription refills for mental health care, and the ones who have dependent age children. There is a belief, I think, in the civilian world that there is almost like luxury care for children and families of military personnel, but they don't know how many of them need social services themselves, or how hard it is to get their children in to see hospitals, see a physician, even in VA hospitals. And so that is shameful to me, that we have men and women who are willing to put everything on the line in defense of this country, and for us to not prioritize their care while they're in uniform and after is a complete slap in the face. And again, as someone who's got family members who are veterans, it hits even more personally for me, because fortunately my family members haven't had to utilize the VA, but a lot of my students and a lot of my friends here have, and it has been a nightmare for them. And that's not what was promised to them when they signed up. So that'll be a priority for me, is making sure that military families and veterans have the resources and supports that they have earned when they need to access those in a timely fashion.